offering of High Ridge House entitled Healing and Supporting You More Than Medicare. High Ridge House has been a Christian Science sanctuary for healing for nearly 80 years. By next year will be our 80th year since 1941. Over that time period, we have had a nice long track record of healings on radical reliance through Christian Science treatment and the practical support through Christian Science nursing. Today's meeting, we're going to talk to you about a number of important developments that we have come to, and also to give you a very brief update, a little bit more information about Medicare. For those of you who are not at this meeting, but can tell your friends, this meeting is being recorded so that it will be played during, we will do an after meeting replay, and it will also be sent out to those, our mailing list. Okay, so the importance for us of this meeting is something that we've all learned through Christian Science from this wonderful statement from Mrs. Eddy. It just came to me this morning. Only through radical reliance on truth can scientific healing power be realized. And we all know that because we're all deep and dedicated students of the science. And what we have also learned is that there's been some additional supports for Christian scientists, like the Medicare program that the Christian Science Church has been a part of since Medicare's inception. High Ridge House, like many other facilities, is considered a religious, non-medical healthcare institution, or what we fondly call RINKI. So there's about 17, 16 RINKIs around the country that are certified to accept Medicare benefits. So today, though, is going to be a whole different discussion. This is really meant to be a family conversation with the field. So we hope that you will take it as such. There will be opportunity to ask questions later on, or even beyond this meeting. And that, but I wanted us to just be kind of comfortable. You're all at home, and to just begin thinking about what this all means to each and all of us as a field. To begin us on the right spiritual foundation, I would like to introduce Marilyn Bradshaw, the Vice President of High Ridge House Board of Trustees.
I shall read from the Bible, 1 Corinthians. Grace be unto you, and peace from God our Father, and from the Lord Jesus Christ. And I, brethren, when I came to you, came not with excellency of speech or of wisdom, declaring unto you the testimony of God. And my speech and my preaching was not with enticing words of man's wisdom, but in demonstration of the Spirit and of power, that your faith should not stand in the wisdom of men, but in the power of God. As it is written, eye hath not seen, nor ear heard, neither have entered into the heart of man the things which God hath prepared for them that love him. But God hath revealed them unto us by his Spirit. Now we have received not the spirit of the world, but the Spirit which is of God, that we might know the things that are freely given to us of God. And from the writings of our leader, Mary Baker Eddy. Christian Science reveals mind, the only living and true God, and all that is made by him, mind, as harmonious, immortal, and spiritual. The 5 material senses define mind and matter as distinct, but mutually dependent each on the other for intelligence and existence. Wholly apart from this mortal dream, this illusion and delusion of sense, Christian Science comes to reveal man as God's image, his idea, coexistent with him, God giving all, and man having all that God gives. Christian Science induces rest in God, divine love, as caring for all the conditions requisite for the well-being of man. Now back to Maravik.
Thank you, Marilyn. And now you will hear from Susie West, who is our business manager. Susie West is the business manager that is also the business manager for the Leaves in Dallas, Texas. So we do share the same business manager, and she will give us a very brief overview of Medicare.
Hi, everyone. Okay. Medicare is designed for temporary urgent care and ends when the patient no longer has care needs that would qualify for Medicare coverage in a hospital or skilled nursing facility. When a patient is admitted to High Ridge House, our Utilization Review Committee, URC, will determine whether a patient needs a Medicare-covered level of care. The committee includes our Director of Christian Science Nursing and our Executive Director. Even if we decide a patient needs a Medicare-covered level of care initially, we may later decide that the patient no longer qualifies for Medicare coverage because the condition has improved. Christian Science nurses expect quick healing. This progress may result in determining that a patient's coverage no longer warrants Medicare coverage. As Christian scientists, we should expect progress and rejoice in healing. Part A Medicare coverage includes Christian Science nursing services, room, meals, and some nursing supplies. Part A coverage does not include Christian Science nursing care that does not require a journal-listed Christian Science nurse, Christian Science practitioners, personal items such as telephone and hairdresser charges, rest and study, private duty, or home nursing. Medicare rates change annually. For 2020, the first 60 days of coverage requires a $1,408 deductible, followed by a 30-day period of coinsurance where both Medicare and the patient pays $352 daily. In 2019, High Ridge House admitted eight Medicare patients, approximately 20% of our annual revenue. In 2018, 7 Medicare patients were admitted, which was approximately 10% of our annual revenue. It is important to understand that Medicare does not cover 100% of the facility's costs to operate and provide care. An inherent amount of benevolence is given to all those who have Medicare as their payer. Now I will give you back to Maravik.
Thank you, Susie. We will have a fuller Medicare specific only to Medicare webinar in January. So you will hear more about Medicare at that specific outreach program we will be offering. But the most important thing is for you all to understand some new decisions that our Board of Trustees and we as a staff have reached at High Ridge House. And to talk about that metaphysical foundation is Marilyn Bradshaw.
Thank you, Maravik. I'd like to begin with the mission statement for High Ridge House, which is healing through loving Christian Science nursing care. High Ridge House is a sanctuary for healing. And this sanctuary is not only a quiet place that is physically apart from the world where human needs are lovingly met. It is a spiritual atmosphere of thought. This spiritual atmosphere is maintained through prayer and watchfulness. Christian Science nurses and staff bear witness to truth and actively rule out material sense and its false beliefs and laws. While Christian Science nurses are physically caring for their patients, they are striving to spiritualize thoughts and actions, to behold the perfect man, and to recognize and destroy aggressive mental suggestions of discord and disease, thus defending the mental atmosphere surrounding their patients. Medicare and private insurance require Highridge House to create written records and submit reports documenting in detail a patient's physical condition. This presents a stark challenge to maintaining the purely spiritual thought that supports healing. When Highridge House first began accepting Medicare, the required paperwork was less problematic. But in recent years, the reporting requirements for both Medicare and private insurance have become increasingly contrary to the principles of Christian Science. I'm going to explain specifically what these reporting requirements are and how they weigh against the practice of Christian Science. It's a rather lengthy and detailed explanation, but we feel that it is important to present it so that you will understand our decision to withdraw from Medicare. When someone who may be eligible for Medicare seeks to be admitted to a Christian Science nursing facility, the Christian Science nurse handling the admission must record the prospective patient's date of birth and a detailed description of their physical condition. A decision must be made whether the ailment is severe enough to qualify for Medicare. This is not a diagnosis, but it focuses thought on the condition of the patient's body. If the patient has private insurance, he or she must also provide details of that insurance, because it is necessary to obtain pre-authorization from the insurance company prior to admission, or else coverage will be denied. In addition, the insurance company requires a history of the patient's condition and an explanation of why they can't be cared for at home, because that is generally less expensive. If the patient has not had a medical diagnosis, the Christian Science nurse must provide a detailed description of the specific health problems and disabilities, referring to specific parts of the body. Once the patient is admitted, there must then be ad hoc meetings of Christian Science nurses whenever the level of nursing need changes. At these meetings, details of specific physical aspects of the patient's condition must be discussed, agreed on, and recorded. Then, as our business manager explained, the facility must have a utilization review committee consisting of the executive director, the director of Christian Science nursing, a board member, and usually one other Christian Science nurse. This committee must meet at least once a month to review the minutes of the ad hoc meetings in order to ratify the decisions and ensure the accuracy of the minutes, adjusting wording as necessary, and justifying the need for the care or oversight of a journalistic Christian Science nurse. The minutes must describe any specific changes in several categories: mobility, turning and positioning, personal care, and nourishment. I'm going to share a sample excerpt from actual minutes. It's rather graphic, but it clearly illustrates the kind of observation that must be recorded and reviewed. Mobility. Patient not bearing any weight. No change in swelling of lower legs. Legs continue to move involuntarily at times. Patient is able to kick lower legs forward when seated. assessment, skills, and judgment of journalistic Christian Science nurse required for mobility due to unpredictable pain and changing needs. As this excerpt plainly illustrates, in order to meet Medicare and insurance reporting requirements, thought must focus on physical conditions and the specific words used to describe them. All physical changes that require a change in the care plan must be detailed in writing. If the severity of the physical claim is not adequately described, the patient could be seen by Medicare as no longer eligible for reimbursement. And if there is improvement, as Susie mentioned, the URC committee may decide that the patient no longer qualifies for Medicare. When financial consequences are involved, the reporting decisions place a heavy responsibility on the Christian Science nurses. In all cases, it requires extremely clear metaphysical alertness to maintain a spiritual healing thought when it is necessary to create frequent material records of bodily conditions. Christian Science nurses handle this with much prayer and care, but it's a big challenge. Private insurance also requires that physical improvement goals be established for patients and requires progress reports at least every 2 weeks. The progress reports for each case are reviewed by a Utilization Management RN, a medical registered nurse who works with the insurance company and decides whether or not to continue insurance coverage of the treatment being given. If there is little or no progress for X number of weeks, the RN, the medical nurse, may decide that the ailment is chronic. And if the policy doesn't cover long-term care, the insurance coverage will be discontinued or denied altogether. Such a decision, made by a medical nurse, labels the patient as incurable. This is a lot to take in, isn't it? But regrettably, there's even more to explain. Another issue is that neither Medicare nor private insurance will reimburse Christian Science nursing facilities for the cost of religious-only activities. Facilities are required to track and report minutes of time spent by Christian Science nurses. The time spent on religious-only activities must be recorded separately from time spent on physical care and related duties. If a Christian Science nurse voices the truth to a patient while providing physical care, those are reimbursable minutes. But if a Christian Science nurse sits and reads to the patient an article recommended by the practitioner, those are non-reimbursable minutes and must be charted separately. This requirement to be aware of time and categorize it is an imposition on the thought of the Christian Science nurses and tends to materialize caregiving. Also, when a facility's costs for Medicare patients exceed the TEFRA cap, as is always the case, and this is far too complicated to explain here, the facility can seek additional reimbursement by applying for an exception from the cap, but they must justify the additional care expense by documenting that the healing takes longer than it did in the base year, which is 1982. In other words, there is a financial incentive to argue that in the present era, healing does not happen as quickly as it used to. This is another aggressive claim of animal magnetism that Christian Science nursing facilities are required to go along with humanly in order to obtain additional funds to cover their costs. We're almost at the end of the Medicare issues, but there is one more egregious imposition that you need to know about: the code that Christian Science nursing facilities must use when filing Medicare claims. The American Medical Association developed a system of codes with a diagnosis code for every kind of illness, and this system has been adopted by the government. Because Christian Scientists do not get medical diagnoses, they must use a special code, and this is the wording: Diagnosis Code Z53.1. Procedure and treatment not carried out because of patient's decision for reasons of belief and group pressure. By merely filing a Medicare claim on behalf of a patient, the Christian Science facility is affirming that the patient is acting out of mere belief and not understanding, and is not really choosing Christian Science treatment because of their own convictions, but is succumbing to pressure from other Christian Scientists. We know it is not true, but we are forced to misrepresent the patient's thought and use a code that falsely portrays Christian Science treatment as essentially irrational. The bottom line is that Christian Science nursing facilities succeed in getting reimbursed by Medicare and by private health insurance only by going along with the reporting demands of a medically oriented system that is aggressively pulling thought in the opposite direction from the spiritual reality Christian Scientists are striving to demonstrate. Mortal Mind's specific argument is fear-based, that healing takes a long time, and Christian Science nursing care is expensive. Therefore, it is necessary to go along with whatever kind of reporting is required so that Medicare or private insurance will pay for the care. There is another related fear-based imposition, that because some cases are not eligible for Medicare, and because insurance companies so readily pay for medical care, Mortal Mind argues that going the medical route is much less expensive than Christian Science care, and therefore is a more financially feasible option. These fears work against the most effective treatment for all ailments, pure Christian Science. And Highridge House wants to remove the fear by ensuring that financial assistance is available to replace Medicare for all who need it. We'll hear more about that in a few minutes. Another aggressive mental suggestion must be mentioned. Mortal Mind tries to make some people feel uncomfortable or unwilling to ask for or receive financial assistance, especially if they have paid into Medicare or purchased private insurance and expect to use it. But the most important consideration is what best supports healing. We cannot afford to allow any consideration, however humanly reasonable, to deprive us of the immense blessing of pure spiritual healing. Some Christian Science nursing facilities have concluded that it is beneficial to continue to accept Medicare as well as private insurance. On the other hand, 4 Christian Science nursing facilities have withdrawn from Medicare in recent years because they determined that the requirements were incompatible with Christian Science nursing. These are Fern Lodge, Olive Glen, Wide Horizon, and Glenmont. Also, 10 Acre decided long ago not to participate in Medicare. Policies regarding the acceptance of Medicare and private insurance must be determined by each facility according to its own demonstration. After much prayer and careful consideration, High Ridge House has chosen to withdraw from Medicare in order to best support healing for those who come to us for Christian Science nursing care. Now, back to Maravik.
Thank you, Marilyn. I know for all of you, that was a lot to take in. This is a big, big bite, big thing to swallow, but we're hoping to give this to people in smaller bites. And this is one big gulp right now. But as I said, this is a continuing family conversation. This is High Ridge House is here for you 24/7. So you can always call upon us. But one of the things that Marilyn mentioned is our Board of Trustees has really been focusing on how can we best support the field in helping understand our withdrawal from Medicare, and how can we best support you in your healing work and in the healing that you need to have while you are at a nursing facility. So there have been some wonderful developments in the last few years that has happened for the entire nursing field. To begin talking about that, Susie West and I will talk about the financial assistance that's been available for those who need Christian Science nursing care. We are really blessed that there's a group called the Philanthropy Forum. All the donors, foundations, institutional and individual, have banded together in what's called a Philanthropy Forum to when they started the National Fund for Christian Science Nursing. And Susie will begin talking about that. And we will have some screen sharing, so you'll see some things on the screen. Go ahead, Susie.
I am looking for it now. Hold on. Oh, no, that's not it. Oh, here we go. Oh. It was on. I was going to show everybody the nfcsn.org website. It's very easy to get to. It's nfcsn.org. It's not pulling up. I had it all set up on my computer, and now it's not on. So I was just going to give you, it's a very easy way. They are the most loving bunch you would ever want to know. They work with each one of you to come up with a plan. They can go ahead and give up to $350 a day for care in a Christian Science nursing facility. And so it's a very easy process. I help patients coming in. Maravik will help patients coming in. We all help, and they make the process so easy and harmonious. And they're thanking you guys for coming to them. I mean, isn't that incredible? So I love that. They want you to use the National Fund for Christian Science Nursing. So I just think that's a lovely way. They thank us in advance for using them when we're wanting to thank them for, giving us such a gift. So it's a mutual blessing. So that's one avenue. The second avenue is High Oaks Foundation. And we happen to have a couple of our wonderful High Oaks board on the call with us, I think Nancy Batty being one, and they have been so loving. There she is. They have been so loving. Their application process is just so easy. They are another loving bunch that just, wants you to come to them when you need help. And like I said, the application is so easy, and they are there on the phone if you need any information at all. And again, we are very blessed to have these two foundations available for us for Christian Science nursing. Back to you, Maravik.
And then last but not the least, of course, over and above what Susie mentioned, the National Fund and High Oaks, we have High Ridge House's own Benevolence Fund. Many of you have donated to that Benevolence Fund over the years, and we are very, very grateful. And we continue to gratefully accept donations to that Benevolence Fund. And because of this withdrawal from Medicare, we are rethinking how that new Benevolence Fund would look like, and would welcome any ideas you may have around that. So I think that I also want to mention that a trustee for High Oaks is on the call, Christine Polito. Christine, you might want to wave later as well. And go ahead and visit their website also. I think we are really very, very blessed as a field, because there's hardly any insurance, private insurance, that covers Christian Science nursing care. But the whole field of donors and other thinkers in the Christian Science nursing movement have really come up with this national fund and other sources of funding. And High Ridge House has also been working diligently. This year alone, our benevolence assistance will probably reach to $300,000 as of the end of September. So it's quite high. Every year it seems a little higher, because many of those patients don't qualify for Medicare anyway, or else they used up their own personal resources, and then the care needs are still quite high. And so this is something that we all need to continue to pray about, because we want to experience, as Mrs. Eddy said, quick and whole healing on page 92, and really demonstrate that, not just for ourselves, but for others, but for the entire Christian Science field. Now, this is the moment in time for you to give us questions, comments, and I will open it up. I think that if you are waiting, there's a little in the bottom panel of your computers, there's a thing called chat. You can put in there and chat and type in a question. If you don't want everyone to see it, you just put this thing down below and just send it to me. Don't send it to everyone. When is the withdrawal effective is the question. Great question. Marilyn, would you like to answer that?
Well, we felt that it's important for the field, for the Christian Scientists that we serve, to understand our reasons for leaving Medicare and to understand what is available to them. And we're grateful that so many of you are on this call, but there are many others that we need to reach out to. And we will be holding a series of other meetings, perhaps with individual branch churches, Zoom meetings, to be sure that everyone has this understanding and is comfortable with this decision and knows what to expect. And as Maravik mentioned, we also expect in January to have a more detailed presentation by Leslie Connery of the Mother Church, who will explain more about Medicare and Medicare Advantage plans and that sort of thing, so that you will be helped in knowing your options. And at some point early next year, after we've had that presentation and some of these meetings, and when we feel there is a general understanding, we will set an absolute date by which anyone admitted after that date, we will not be seeking Medicare reimbursement for them.
Okay, you can also, I will have put on gallery view, you could raise your hand and I could call on you. And unmute yourself. Nancy Batty, the head of High Oaks. Nancy, go ahead.
Hi, thanks for this wonderful and very helpful meeting. I just wanted to tell people that High Oaks will support Christian Science nursing care in a facility or at home for individuals who live in 6 states. And those 6 states are New York, New Jersey, Pennsylvania, Delaware, Virginia, and Maryland, and District of Columbia. And that we partner with the National Fund frequently to make nursing bills, pay nursing bills for individuals. So High Oaks works very closely with the National Fund and has a very good working relationship with them to work out good financial support for people who apply. So yes, I do encourage you to go take a look at our website. It's High Oaks Inc., INC, Incorporated, .org. And you can see there what we support. We also will assist with practitioner costs, Christian Science nurses training courses, emergency expenses, and Christian Science camp tuition. Often an individual who is receiving nursing care needs help with other expenses in their working out their situation. So we do often supply that too for individuals. And we're always happy to answer questions if you want to call and talk.
Thank you so much. I want to just reassure everyone that when you are admitted to High Ridge House, we actually, or when you even call for admission, we actually don't ask you anything about your financial status or need. That's not part of the admission process. So we admit you without regard to that consideration. When you do come in, after a while, Susie or myself meet with the patient to begin talking about, because we want you to, you're already dealing with something. So we don't want that burden or imposition of the cost of the care, although the cost of the care is important. So then we work with you to see, do you need financial assistance? Are you going to be able to pay for this on your own? And we will work with you and in your application to those financial assistance organizations, High Oaks and National Fund. Okay.
Can I say something, Maravik?
Sure.
I also wanted to say that I know most of the conversations I have with people is one-on-one. You know, I welcome you guys and invite you guys to call me and let me know what your situation is. If you've got some insurance you need me to look at, if you're wondering about something, I am always there ready to answer questions and talk through, because I know everybody's got something different. So I welcome and invite you guys to call me directly if I can help you kind of work through and wade through any of this.
And all of this is a confidential process because we are governed by HIPAA, and we keep all your financial and health information private and confidential. There is a question that says, if you have Medicare, can you still be accepted to High Ridge House even though it isn't used? Yes, that is definitely true. So when we decide on that specific point where we will no longer seek reimbursement from Medicare, yes, of course, we will allow you to come into High Ridge House. Another question.
Oh, sorry. I was just going to say, somebody asked a question about serving Christian Scientists, SCS. And really, again, please give me a call, because I do know Renee, who works at SCS, and we can always get on a phone call with her and find out about your individual policy. They have a myriad of policies there, and we would just need to find out what it is that they cover for you. And I'm always happy to be an extra set of ears as we go through this process.
I saw.
Marvick, I might just add that my previous research about SCS is that because of the strange insurance laws in this country, they are not legally allowed to operate in the state of New York, where High Ridge House is located.
Thank you, Marilyn. I believe Carol Aiken had her hand up.
Yeah, I was just, thank you. Just wondering how the Mother Church has felt before, and I'm assuming they are encouraging you all in this decision. I'm wondering where they were and where they are now.
I would say that the Mother Church doesn't actually take any position regarding whether facilities stay or withdraw from Medicare. There's an entire organization called the Christian Science Provider Network that helps all the facilities get reimbursements and work on the claims for private insurance as well as Medicare. And that was started at first at the Mother Church, but it's now a separate entity. They really don't take a position on it. I still I attend the Rinky meetings every month with all the facilities. So, and they do know that we've already are working on withdrawing from Medicare. The withdrawal process doesn't really happen as quickly as you think. So there's a whole process that happens in order to withdraw from Medicare.
One of the reasons I asked was that it was noted that the Mother Church was going to have someone speak at the next Zoom meeting, I guess in January or something. Did I hear that right?
Yes.
So I assume they had a position.
Well, she definitely advocates for Medicare, and she is the Medicare attorney, Leslie Connery, who's very knowledgeable. She even used to work for Medicare, and she's going to work with us and doing a whole segment on that, as well as advanced health directives. So she's been doing that for other facilities as well. So we want to develop that opportunity. You know, we still work in partnership. This is such a small family in a way, even though we're national and international. We have facilities in other parts of the world. We are all working together in many, many different ways. We have monthly meetings, all the executive directors, whether they're religious, they're Medicare certified facilities or non-Medicare, we still all meet as EDs together, especially during this pandemic. It's been very, very helpful to all work together regarding imposed regulations. Then there's a specific Rinky meetings that happens on the second Monday of every month. And High Ridge House actually co-hosts that meeting by Zoom, our new best friend. Okay, can we get Susie West's phone number? Barbara, yeah, we will send that to you. And you can always call High Ridge House as well. And we will give you that number, but I can send that to you. Any other questions or comments? How do people feel about this move? Don't be shy, tell us. It's like telling your cousins, you know, oh, they're leaving the family of Medicare. We're still cousins. I did see this. I just thought it was important for us to kind of really talk openly about this. So if people have any other comments.
I'm actually very, very delighted and support this idea tremendously, because if what we all heard is true of what Medicare is requiring, then the focus of the nurses' thoughts on matter, when they're supposed to be completely denying the reality of matter and seeing the patient spiritually, is completely antithetical to progress and healing. So I think this seems to be that if they're requiring that, a very right decision to get out of that requirement.
Thank you very much, Carol. Last year, we did have a meeting with practitioners, teachers, and Christian Science nurses to first announce this. And it was very, very well received. Actually, we've had a couple of practitioners who said, why haven't you done it yet? You need to do it now. A couple of teachers have called me and said, when is this happening? And so I think there's really good support for it. What we're looking to you for is your prayerful support, because as we know that we want to progress out of matter, just like the organization has to progress out of this, this reliance upon Medicare. I wanted to just share this thing that I just saw that came to me during the meeting. The theology of Christian Science includes healing the sick. Our master's first article of faith propounded to his students was healing, and he proved his faith by his works. The ancient Christians were healers. Why has this element of Christianity been lost? Because our systems of religion are governed more or less by our systems of medicine. So this is something that we all, I know I'm probably preaching to the choir here, but we all need to be so alert that the medical industrial complex, it has penetrated many aspects of our lives. I mean, you just turn on the TV right now. It's really outrageous. So I think that this is something we have to still continue to demonstrate as a whole movement, to demonstrate out of that, and that we will then have more effective and more quick healings. Again, if there aren't, a recording of this meeting will be posted to our website at highridgehouse.org by this weekend, so that you'll have a chance to listen to this again. But as I mentioned, we are here. You can give us a call. Our board of trustees is a very active board of trustees. And I don't want to put Marilyn on the spot, but lots of other facilities have called her. And so you can call her, and you can continue to talk to us about this. I think the biggest thing to first handle is the unnatural reluctance to seek help at a Christian Science nursing facility. And that's the first thing I want all of us to really earnestly pray about, because when sometimes people call us, and I know some of you on the call have called me, who are trying to help a neighbor or a friend or a fellow church member, and sometimes it's almost at that a little too late point. We've had to come rescue them from a hospital, or a neighbor had to, the patient collapsed in the apartment. So call on us early on. Sometimes we can just help for care on the telephone. We've done a lot of stuff on telephone. We were doing telehealth before the medical community did this, okay? Because everything, people call their practitioners. And so that's telehealth in itself. I think that people call us, sometimes they can't sleep. We're open 24/7. We've just read hymns, or sometimes nurses have sang hymns to people over the telephone. And so we're here for you. We are you. You are you. This is your sanctuary for healing and renewal. And we exist because of you. So I think that this is a beginning. And if there's no more questions or comments, I would like to thank everyone who spoke. And Marilyn is going to give us a closing right now, and then I will close again. Go ahead, Marilyn. Marilyn, you're muted.
You're muted.
About
You're muted.
that.
There.
Okay. First, I would just like to say, yes, I would be glad to speak with anybody that has questions about what I presented or would like to talk to me. You can get my phone number from Maravik. Now, Mary Baker Eddy writes in miscellaneous writings, truth is supreme and omnipotent. The truth of mind healing uplifts mankind by acknowledging pure mind as absolute and entire. Pure mind gives out an atmosphere that heals and saves. Our goal at High Ridge House is to reflect pure mind, to maintain the purely spiritual thought that heals, so that those who come to High Ridge House may, in the words of our leader, rise up, regenerated, strong, free, their countenance beaming with health and happiness. There is in Science and Health a profound and powerful statement, a spiritual law that is a bedrock truth for Christian Science nursing. And it is this: divine love always has met and always will meet every human need. The truth of this statement has been proved at High Ridge House for nearly 80 years, and we are confident that it will continue to be proved for High Ridge House and for you, for all who choose to rely on Christian Science for healing and come to High Ridge House for Christian Science nursing care. Now back to Marvick.
Thank you, Marilyn. Again, I want to thank all of you for taking time out of your very active schedules to really ponder this topic of how we can all support one another through healing and how we can be a more caring community. So thank you once again. We are here for you. Give us a call. Many of you have my cell phones, and so call High Ridge House if needed. And so if there are any questions that we could answer for you, please do so. And I just want to thank everyone, and I will say goodbye. But people can say hello to your friends right now. And Gabby.
Thank you, Maravik. Marilyn, Susie, thank you.
Thank you. Is that Chip?
Of course.
Thank you, Chip.
Thank you, Marvick. It's Marita. Thank you for a wonderful program.
Good.
So
And
much.
Thank you,
so
Maria.
much.
Thank you for all the High Ridge House church reps that are on the call. Thank you. You're carrying the banner of High Ridge House for your branch churches. Hello, Ann Carter.
Thank you so much from Colombia, South America.
Oh, Colombia.
Oh my
Hola.
gosh.
Gracias, Antonio.
Aquí estoy, Antonio González Rubio.
Good.
Sí.
Okay. And we have people from Maryland, and Lynn London is here. So this is great.
Hi,
I'd
Lynn.
like everybody to know I'm not Marvick Mabanek. I have my own name. For some reason, it's Marvick Mabanek under my name. But that was very well done, very well presented. And thanks, Chip, for being on here with me. You can sure tell that woman is the higher thought.
Yeah, we're in great hands along with God and the women.
There you go. Love to all of you.
Yes.
Thank you very much.
Thank you all again.
Marvick and Marilyn and everybody from Nancy and Lester.
Oh, thanks, Nancy. All right, you
nice.
guys. Hello,
Hi
Cheryl.
there.
Osceola. We have a lot of people who are
Yes.
friends of High Ridge House. Thank you all. We had excellent attendance, and thank you. Keep praying with us about this, and we look forward to being in touch again. Much love.
Thank
Bye-bye.
you.
Much love.
Thank you. Thank
Adios.
you.
you.
Thank you.
Bye.
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 Thank you.